If you've ever heard someone introduced as Dr. So-and-so, the nurse, you might have kind of paused for a second, right? Like, are they a medical doctor, a researcher with a PhD, or something else entirely? And that's a totally valid question because honestly, in the world of nursing, the whole doctoral landscape can get a little confusing. So let's unpack this tale of two doctorates and figure out why it actually matters for all of us.
And that really gets us to the heart of the matter. You see these letters all the time. PhD, DNP. But what's the difference really? And more importantly, why should you even care? Well, it turns out the distinction is absolutely crucial. One is all about creating knowledge, and the other is about using it. And understanding that difference, well, it has a huge impact on patient care.
Okay, so to really get a handle on the newer degree, the DNP, we've got to rewind the clock a bit. We need to talk about its older sibling, the PhD. See, for decades, the nursing profession was on this big mission to establish itself as a real scientific discipline. And the key to doing that? Well, it was all about creating a path for nurses to become top-tier, world-class researchers.
And you can really see that ambition play out on this timeline. The whole journey kicks off way back in 1934, when NYU started the very first PhD program in nursing. Fast forward 20 years to 1954, and the University of Pittsburgh kind of sharpens that focus, aiming it right at clinical research. And by the time the 60s rolled around, the direction was crystal clear. Nursing was becoming a science, and the PhD was going to be the gold standard for its top researchers.
So here's the bottom line. A PhD in nursing is a research degree. That's its whole reason for being. It's designed to create nurse scientists, people who conduct studies, crunch the data, and generate brand new knowledge. These are the folks who are pushing the boundaries, advancing the fundamental science of how we care for people. But just as the PhD was carving out this super important role, a brand new problem started bubbling up in hospitals and clinics.
And that problem was a widening gap, a real disconnect. Think about it. Over here, you had all this brilliant research coming out of universities, but over here, you had the super complex, fast-paced reality of everyday patient care. The two worlds weren't connecting the way they should. It was obvious a new kind of leader was needed to bridge that gap.
And man, this quote just hits the nail on the head. It perfectly captures how people were feeling. For a lot of nurses out there, on the front lines, the PhD just felt distant. It was seen as way too academic, too theoretical, maybe even, and this is the key word, irrelevant to the challenges they were facing with patients right then and there. And believe me, those challenges were really piling up. Medical knowledge was just exploding. Patient care was getting more and more complex by the day. And on top of all that, you had these national reports coming out raising huge red flags about patient safety. The system desperately needed experts, not just at the bedside, but leaders who could design, test, and roll out better, safer ways of delivering care. And that was a void the PhD just wasn't built to fill. So to tackle this widening gap, a modern solution finally emerged: the Doctor of Nursing Practice, or as you'll see it, the DNP. And this wasn't just, another degree with a few extra letters. No, this was a complete, fundamental rethinking of what a nursing doctorate could even be.
Okay, and this right here is where the difference becomes crystal clear. Look at it this way. On one side, you have the PhD. Their goal? To generate new research. They're focused on scientific discovery. But on the other side, you've got the DNP. Their goal? To translate that research into actual practice. They're all about leadership and improving quality. So, one advances the science, the other applies that science to make things better for patients, right now.
Here's a really great way to think about it. Imagine the PhD nurse is like a scientist in a lab who invents a brand new, super strong type of steel, okay? They've created new knowledge. Now the DNP nurse, they're the master engineer who takes that amazing new steel and figures out how to use it to build a better, safer skyscraper. See? They're both brilliant experts, but they're applying their genius in totally different, but equally important ways.
So when you look at the formal definition of the DNP, it just reinforces this whole idea. It's what's called a terminal degree, meaning it's the highest you can get in the field, but here's the key. It's a degree in nursing practice. Its entire mission is to create leaders who can take the best research out there and use it to totally transform patient care right where it happens.
So the idea itself was incredibly powerful. And once it really got a foothold, the growth of the DNP was just explosive. It completely changed the entire landscape of advanced nursing practice.
And the momentum built up fast. It really started to gain traction in the late 90s, with Columbia University pioneering an early model. But the real game changer,
That came in 2004. That's when the American Association of Colleges of Nursing, the AACN, gave the DNP its official stamp of approval. And that was like the starting gun. By 2005, universities all over the country were scrambling to launch their own DNP programs. The rush was officially on. And just to give you a sense of scale, check this out. Since that big endorsement back in 2004, more than 96,000 nurses have graduated with a DNP. I mean, think about that. This isn't some tiny niche degree anymore. This is a massive wave of highly trained clinical leaders flooding into the healthcare system, armed and ready to tackle its biggest, most complex problems.
Which really leaves us with one big final question to think about. We now have what? Almost 100,000 of these master engineers out in the field translating science into safer, better care every single day. So the question is, how is this new generation of practice-focused leaders going to continue to reshape the future of healthcare for all of us?